Hi, good morning, everyone. I'm Serene, one of the scholarship officers with Healthcare Scholarships and Talent. To start off, a warm welcome to Day 8 of the Healthcare Scholarships Virtual Experience 2021. For some of you who have attended the earlier sessions, welcome back again and thank you for joining us for this segment. Throughout the 2 weeks of virtual events ending on 3rd March, you will get the opportunity to participate and interact with scholar ambassadors, scholarship officers, university partners, and professional representatives from various public healthcare institutions. Welcome to Dare to Care, a call to our future healthcare scholars. Join the Healthcare Scholarships team for this information session to learn more about making a difference with healthcare scholarships. In addition to an overview of scholarship schemes offered, you'll be able to interact and hear from our administration, medical social work, diagnostic radiography, and nursing scholar ambassadors, scholarship officers, and representatives from the various public healthcare institutions. Before we begin, we have a few housekeeping rules to take note. So firstly, if you have any questions for our speakers, please feel free to type it into the Q&A function. If you would like to direct your question to a specific speaker, please kindly indicate it in your question. Lastly, if you see a question that you are interested in being answered, please upvote the questions. So for this segment, we have 2 Q&As. One Q&A will be for the scholarship officers, and the second Q&A will be for scholar ambassadors. Secondly, do note that our exhibitor booths are open for chats from 10 a.m. to 4 p.m. today. Have more questions? Feel free to chat with any of the representatives. Lastly, we have an ongoing leaderboard and contest section for participants to win attractive prizes, such as Universal Studios Singapore one-day pass, Disney Plus subscription, Grab food vouchers, and many more. Before I pass the time to Li Ying, who will be sharing more about making a difference with healthcare scholarships, please sit back and watch our mid-event video on how the Healthcare Scholarships virtual experience has been so far. Do note that if you have missed any programs that you're interested in, replay is available. We'll show the video now. Thank you.
We are leveraging on technologies and innovations so we can improve on patients' experience, patient safety.
What I like is definitely the volunteering opportunities that we have, just where I get to meet a lot of the other scholars as well.
So a reason why I chose nursing and I'm still really enjoying nursing is actually because of the diversity.
So I think one of the major qualities is really your passion and how you want to contribute to the healthcare community.
Every year, we will actually have close discussions with our industry partners. That's why then the intake size, etc., will also be adjusted accordingly as well.
In terms of future of nursing, currently we actually use medical device integration.
Or when we speak to our nurses or doctors, we find out what programs are necessary to bridge their knowledge gap.
Every student gets their own 3D foot model to be able to practice and learn on. So in this one, they're actually learning to do wound care management.
Because we are the only pharmacy school in Singapore, we are always thinking about how to deliver the best program for our students.
So I managed to attend an overseas healthcare course on global health in London because of the MOH scholarship.
Okay, hi everyone. I'll be proceeding with the healthcare scholarships talk now. Okay, some of you have been with us for the past few days, you probably have seen me host some of the events. Okay, those who are seeing me for the first time, hi, I'm Li Ying. I'm from the Healthcare Scholarships and Talent team. I'm one of the Healthcare Scholarships officers, and mainly I take care of the physiotherapy, dietetics, prosthetic and orthotics, as well as orthoptics scholars. So without further ado, let me start sharing by how it can make a difference with healthcare scholarships. Okay. So Singapore's healthcare system is actually one of the best healthcare systems in the world. You can see that we are top in terms of healthcare, key healthcare indicators, second in terms of most efficient healthcare system, and first in terms of healthy life expectancy. So even with a good healthcare system and being one of the top ranked healthcare systems in the world, we also face quite a number of challenges. So firstly, we have aging population. This is quite common and quite has been a rising trend in Singapore for the past few years. And then we also have increasing chronic disease burden because along with aging population, we do see that there are more elderly in Singapore. And for elderly, they are more prone to chronic diseases and certain illnesses as they grow older. Besides that, there's also a declining birth rate in Singapore, so that leads to slower workforce growth. And last, there's rising healthcare costs that we see in our healthcare system, and this is due to a couple of reasons. It could be because of slower workforce growth, where there are lesser manpower available. That's why manpower costs increase, and then medical advancements in the healthcare industry that increased fees for the technology being used, and also increase in operating costs for these newer technology. So to tackle these challenges, the Ministry of Health has come up with three main beyonds for 2020. So first up, we have the Beyond Healthcare to Health. If you have been following like health news closely and being active in Singapore, you know that there are recent initiatives in the past years, for example, like the HPB Health Promotion Board's Steps Challenge, where the government and ministry are encouraging Singaporeans to lead a healthier lifestyle. So it starts from taking care of yourself for your health first, and so that you prevent yourself from getting certain illnesses, and you stay healthy and not need so many healthcare services, which will actually increase the demand of healthcare, which will lead to certain strains on the healthcare system. Yeah, secondly, it's beyond quality to value. So even though we have good quality medical solutions and medical services for our Singaporeans, how can we bring these quality services at a cost that is of value and affordable to our Singaporeans? And last but not least is beyond hospital to community. So we do see that there are more community hospitals and community-related healthcare centers popping up around the heartlands. So there is really a shift towards providing healthcare services in the community, so that certain elderly or certain patients with mobility issues, they are able to seek healthcare services at the comfort of somewhere near their homes. Okay, so these are the three main beyonds for 2020. Okay, to give a very brief overview of the public healthcare players in Singapore. So the Ministry of Health is the policy maker, and at MOH Holdings, where I'm from, we are the strategic partner and execution agent. So we will partner with professional partners as well as employment agencies. So these are mainly your SingHealth, National Healthcare Group, National University Health System, as well as Agency for Integrated Care. Okay. So this is a geographical map of Singapore's healthcare system. In the west, we have the NHS cluster. In the central region and north, we have NHG. And then in the east, as well as part of the central, we have SingHealth. So public healthcare system is largely divided into two segments. So we have primary care, where there are polyclinics, GPs, family medicine clinics, as well as community health centers. And then for hospital care, you all will be familiar with general hospitals like your SGH, Tan Tock Seng, your NUH, etc. Then you also have specialized hospitals such as KK Women's and Children's Hospital, and then Institute of Mental Health. Then there are also specialty centers that provide treatment for like cancer, cardiac, eye, skin, neuroscience, and dental issues. So you have like your National Dental Center, you have your National Neuroscience Center, etc. And then we also have community hospitals. So some of these hospitals are actually located just right next to the acute hospital. So for example, we have Sengkang Community Hospital next to Sengkang General Hospital, and then we have Yishun Community Hospital next to Khoo Teck Puat Hospital. So these community hospitals are really providing a step-down care option for the patients who are admitted into acute hospitals. So these are some of the pictures of the institutions which you may have visited before or passed by. They are pretty common sight in Singapore. And in terms of geographical location, it's quite easily accessible for most of the hospitals in Singapore. Okay, next we move on to community care in Singapore. Okay, AIC is the overall partner for most community care organizations in Singapore. And then in terms of community care, they are largely separated into 3 segments. So first, we have center-based services that includes daycare centers, senior activity centers, and community rehabilitation centers. So for these center-based services, some of you may have seen, like if you live in the heartland areas, there are like silver ace centers at the bottom of like a HDB or certain national NTUC silver care centers that are available for elderly to go for their rehab services in the day, etc. So there are increasing number of such centers in Singapore. And then we have residential-based services that includes community hospital, nursing homes, and inpatient hospices. So these patients who require residential-based services, they're usually staying in one of these places in the community. And last but not least, we also have home-based care, where there is home nursing, home therapy, and hospice home care. So in terms of home-based care, as the name suggests, the healthcare professionals actually provide these healthcare services at the patient's home. So it could be a nurse who may visit a patient at their home to provide wound dressing or follow up in terms of certain appointments or medications. And then we also have home therapy, where therapists may visit a certain patient's home to provide therapy services. So some of these community care institutions you may have seen, like Sengkang Community Hospital, Renci Community Hospital, St. Luke's Hospital, etc. Yeah. So to give an overview of healthcare scholarships, we for students who are interested in allied health and healthcare administration, if you are a A-level student, you may apply for the Healthcare Merit Award, Healthcare Administration Scholarship, or Community Care Scholarship. And then for degree students, if you are currently a related allied health student, you can look at the Healthcare Merit Award or Community Care Scholarship. If you are a non-healthcare related student, you can look at the Healthcare Administration Scholarship. And for non-nursing or allied health final year student or recent graduate, you can look at the Healthcare Graduate Studies Award. For nursing students, or students who are interested in nursing, you can look at O-level students, you can look at Integrated Nursing Scholarship, Community Nursing Scholarship. And then for A-level students, you can look at the Healthcare Merit Award or Community Nursing Scholarship. And then for current nursing students who are in diploma, starting in your diploma or degree student, you can look at both the Healthcare Merit Award as well as Community Nursing Scholarship. And then if you're existing nurse seeking degree conversion, you can look at Community Nursing Scholarship. And then for non-nursing or allied health final year student, meaning you have no background in nursing or allied health, you can look at the Healthcare Graduate Studies Award, which is a master's program scholarship for degree students. So the common eligibility criteria for scholarships is you must have outstanding academic results, followed by good CCA records and strong leadership qualities. Then you also need to have a passion for serving in the public healthcare sector, as well as good communication skills, social and emotional intelligence. I like to highlight that the last point is pretty important because in terms of health, as a healthcare worker, you work closely in interdisciplinary teams at wherever in the health, for example, in the hospitals, in the community-based settings, if you are a nurse, you work with therapists and you will work with like pharmacists and work with doctors. So in a team of different disciplines, you need to be able to communicate well. And besides that, you are also always in contact and interacting with patients. So you need to know how to interact with them properly. And you also get to interact with patients' family as well as perhaps the caretakers. So good communication skills, social and emotional intelligence is really important. So nursing, if you have been following the news closely, you always see that there are more pursuing a career in nursing, and there are always content for promoting the nursing career, such as like the MediaCorp drama. You can be any angel, and then there are also certain initiatives to attract more young students like yourself to join the nursing profession. Okay, so if you are O-level student, you may want to look at the Integrated Nursing Scholarship. Okay, this scholarship is for to aimed at nurturing the next generation of nurse leaders, and for eligibility criteria, you need to be a Singapore citizen, outstanding O-level results, and then you'll be applying or have applied to the nursing course at NP or NYP. For the full eligibility criteria, do check out our website, which we will share the link later on. Okay. Then in terms of the terms and benefit for the scholarships, you will actually get full tuition fees covered, and then you will receive monthly allowances, pre-study allowance, sponsorship programs, and commencement and distinction awards. So the service commitment will be 3 years, and this is after you finish your diploma studies as well as your degree conversion studies. Moving on to the next healthcare scholarships. Before that, I would like to talk about the health science disciplines. These are the 13 allied health and nursing disciplines that we will cover in the next scholarship scheme that I will talk about. So we have your diagnostic radiography, dietetics, medical social work, nursing, occupational therapy, orthoptics, pharmacy, physiotherapy, podiatry, prosthetics and orthotics, radiation therapy, as well as respiratory therapy, as well as speech therapy. So out of these 13 allied health and nursing disciplines, I'd like to highlight that these 5 are our disciplines in need. So if you're interested in one of these allied health disciplines, you do apply for the scholarship, and do take your time to research and find out more about these disciplines, because some of them may be quite uncommon. So some may not have heard of podiatry or prosthetic and orthotics. We do have university partner sessions that have happened earlier this week with the University of Strathclyde as well as University of South Australia, both talking about one of University of Strathclyde covering the prosthetics and orthotics session, and then University of South Australia covering the podiatry sessions. So you can actually play back these sessions to find out a bit more on what these disciplines are actually about, what they do on a daily basis, and what kind of courses that you'll be studying if you enroll in this degree program. So I'd also like to highlight that certain health science disciplines are only applicable to be studied locally if you apply for a scholarship. And for example, nursing, pharmacy, as well as social work will be undertaken at NUS. Okay, and then diagnostic radiography, dietetics, nursing, occupational therapy, physiotherapy, radiation therapy, as well as speech therapy, they are available in Singapore. And then there's also an option to pursue them overseas. And then for certain courses such as orthoptics, podiatry, prosthetics, and orthotics, as well as respiratory therapy, they are only available overseas. So you might want to also do your research to see what universities provide these courses and where they are. Okay, so moving to the details for this scholarship, this will be Healthcare Merit Award that covers the 13 health science disciplines that I talked about. And then it is awarded to promising students with strong academic track records, as well as the passion to serve, to pursue careers in public healthcare. So the eligibility criteria, you will need to be a Singapore citizen or PR, and then outstanding A-level results, diploma or equivalent qualifications. For the Healthcare Merit Award benefits, it includes tuition fees, monthly allowances, travel allowance if you are studying overseas, pre-study allowance, clinical placement expenses, sponsorship for developmental programs, and commencement and distinction award. In terms of service commitment, which is the bond period, you'll have to serve a bond of 4 years after you graduate from your studies if you studied locally, and it will be a 6 years bond period if you studied overseas. So the service commitment will actually be served out in one of the healthcare clusters or AIC community care organizations like we mentioned earlier on. So for the healthcare administration scholarship, it is offered to students who wish to pursue a meaningful and challenging career as a healthcare administrator. So the eligibility criteria, you need to be a Singapore citizen. You will need to have outstanding A-level, diploma, or equivalent qualifications. So for the Healthcare Administration Award, it is actually applicable to all disciplines. So you can study like your business, your accountancy, data science, etc., as long as they are not healthcare related. So not the allied health disciplines that I've talked about, or medicine or dentistry or nursing. Yeah, so these scholarships actually cover tuition fees, monthly allowances, pre-study allowance, and overseas exchange allowance if applicable. Then the service commitment will be 3 years if you're studying at SIT, 4 years if you're studying at NUS, NTU, SUSS, or SUTD. So next we have the Health Community Care Scholarship. This is awarded to individuals with strong academic track records and an interest to serve in community care. The eligibility criteria for this scholarship will be you have to be a Singapore citizen or PR, outstanding A-level results, diploma, or equivalent qualifications, and a strong interest to serve in community. The benefits are actually the same as the Healthcare Merit Award, so I will not touch into it into detail. For the community care scholarship, there is actually a difference in terms of bond period depending on what kind of scholarship that you take up. If you are taking up a full-term or mid-term scholarship in these disciplines, which are physiotherapy, occupational therapy, social work, and speech therapy, it will be a bond period of 4 years if you're studying locally, 6 years if you're studying overseas. For degree conversion, meaning you already have a diploma in one of these 4 disciplines, you have to serve a bond period of 3 years after you graduate from your studies. And then for postgraduate, it will be applicable for speech therapy only, and it will vary from 2 to 4 years depending on whether you study locally or overseas. Next, we have the Community Nursing Scholarship. Okay, this is to develop community nursing leaders in Singapore and is provided in partnership with public healthcare institutions as well as community care providers. Eligibility criteria includes you need to be a Singapore citizen or PR, outstanding O-level, A-level, diploma, or equivalent qualifications, a strong interest to serve in the community, as well as you should have applied to take up nursing studies in local educational institutions. So the benefits are also largely similar. Will cover your tuition fees, monthly allowances, pre-study allowance, etc. Okay. Then in terms of the bond period, it will actually differ in based on which level you take up the scholarship from. So for O-level graduates, meaning we'll cover you for your diploma studies as well as degree program. After you graduate from your degree program, you'll serve a bond period of 3 years. And then for A-level, diploma, or equivalent graduates with no nursing background, you will study your local degree at NUS, and then you will serve a bond period of 4 years. Okay. And then for nursing diploma graduates or existing nurses, you are seeking a degree conversion, you take it up at a local at SIT or overseas degree, and you'll be a 3 years bond after you graduate from a degree program. Okay. So at MOHH, we do have quite a robust scholars development framework. So when you join us as a scholar, there are actually many activities that you can participate in. So before you actually start school, we will organize like a induction camp, induction courses, service learning programs, and then you will actually attend an award ceremony. And then there are also attachment opportunities before you actually begin your studies. And then once you're at school, there are community involvement projects. We used to do them overseas, but because of COVID-19, they have been put on pause. But we will look into reinstating them, and we're also doing community involvement projects locally. And then there can be vacation attachments, like tea sessions with healthcare professionals or healthcare senior management. And then, sorry, student exchange program and seminars and conferences. These are also quite common prior to COVID. And then we also have the Singapore Health Society where you can join and can participate in their initiatives. Once you're at work, there will also be programs such as the healthcare orientation programs, engagement sessions with senior healthcare professionals, networking events and community involvement projects, etc. There's also the Healthcare Society Singapore where you can be a member of as well as join their initiatives. Okay. And when you're at work, in terms of a career, there are quite a number of pathways available for you to develop yourself. So you can either move into clinical management, technology and analytics, clinical or education research, and then leadership or administration and operations. So in terms of timeline for students who are who have already received their A-level results or in their final semester at Polytechnic, you can actually start applying for the scholarships. The deadline are mostly in March, but it could be on different days. So do check out our website for the specific dates of deadlines for the applications. So If you are not in your final year of studies, you can keep in mind that we usually open our scholarship cycle in September every year until the March following year. So if you are only like taking your A-levels at the end of this year, you can start thinking about it and applying from September onwards. So you will need to actually apply through the Bright Sparks portal. It's a scholarships portal where you can submit your applications. And then once we receive your applications, we will look through it. We will shortlist applicants we find suitable, and you will be invited to an interview. Okay, it will be a panel interview with a number of our healthcare professionals as well as scholarship officers. Then if we find you suitable, we will award you the scholarship, and then you will get to take part in the scholars development programs, which I talked about under the framework earlier. And then after, usually if you're studying locally, the school will start in August, and you can proceed on with your studies. So we do have quite a number of activities going on throughout the year. If you are interested, you can sign up for our mailing list. This is the QR code, or you can go to the bit.ly link. Okay, I'll leave this here for a few seconds. Okay. We will send emails to those in our mailing list to sign up for events, and if we have any like reminders for scholarship applications, we'll also send them out. And interesting activities or things that you can look out for in terms of healthcare related careers and scholarships, we'll also send them through the mailing list. Okay, so I've come to the end of my presentation. You can go to our website at www.healthcarescholarships.sg to look at in detail the disciplines as well as the scholarship schemes that I've talked about. And then you can also go to Care to Go Beyond the SG to find out a bit more about allied health and nursing in general. And if you have any queries, you can write to us at talent@mohh.com.sg. And then we also have social media channels on Facebook and Instagram. Okay, you can message us on our social media platforms as well. And we do post quite a bit of content, such as like scholar stories and interviews with our scholars to share a bit more about their life, what do they do, and their career as well as their professions on our social media channels. So if you have time, you want to look up a bit more, you can go to our Facebook or Instagram. So before we move on to the Q&A session, I'd like to play this video that is a video of our scholars, and they do a bit of sharing on what they study as well as the activities that they go through as a MOH scholar. Yeah, can we have the video, please? Thank you.
I'm Jolene, a Year 3 Occupational Therapy student at SIT.
Hi, my name is Han Min. I'm a Year 2 Radiation Therapy from SIT.
Hi, my name is Leon and I'm a Year 4 Physiotherapy student.
One thing that I really remember very well from the scholarship was actually the HSIC, and I actually really enjoyed myself bonding with the other scholars that were being enrolled in my year.
I think the course itself is really fun because we have to work with learning a lot of different activities. So one activity that we learn is leisure. So we got to do paintings, we got to do gardening, and OTs are also responsible for helping to teach people how to use personal mobility assistive devices. So we got to do a bit of wheelchair racing around the place, play with the scooters a bit. It was quite fun.
The most memorable one will probably be my clinical placements. So in school, we actually are taught to actually treat conditions, treat illnesses per se, but when you really get to do your clinical placement, a real patient stands in front of you, you're no longer treating a condition, you're actually treating the person itself, treating his life. So the experience and the satisfaction you get when a patient actually improves, and no matter how small it is something that you can never experience in school on its own.
Hi, I'm Eugene. I'm from NUS Pharmacy. I'm a Year 2 student.
Hi, I'm Hui En. I'm a Year 3 student at Nanyang Polytechnic studying nursing. I think for me, it was more of gaining a lot of overseas clinical exposure because I went to Japan for 1 week and then I went to University of Pennsylvania for 2 months. So it really allowed me to gain a lot of exposure into the different nursing culture overseas as well as the studying culture, and I really learned how to be more proactive and outspoken.
I think for me, it's about learning how to formulate different dosage form in the lab, as well as practicing effective communication, which we learn during our pharmacy one-to-one counselling sessions. Another point is that I really enjoyed my healthcare scholars induction camp because we played many activities that focuses and emphasize on teamwork. And I think this is very important, especially in a healthcare patient-centric setting.
I had to learn to be very adaptable because I planned this really well-detailed intervention. Then the moment I met the patient and I started the first activity, I just took the plan and I threw it out the window because the patient was doing a lot better than I thought he would. Yeah, so I think being able to adjust to the needs of people who are in themselves very complex. Yeah, I think that's quite tough.
During the year one, when we first started, all the classes, particularly it was anatomy and physiology, I think it was really different because the in-depth knowledge that they expect you to know, like, wow, we have to memorize all these muscles and all these different pathways and physiologies. I think it's very different and it's very challenging, but actually it's quite a memorable period as well, because that's when you go through it with your friends, and you get through it together.
Studying is not actually my forte, so especially when it comes to academic writing, examinations, and theoretical textbook studying. So definitely that was the biggest challenge I had, but definitely with friends' help, my professors' help, then everything became much smoother.
So for me, I think like one of the tough moments will be trying to keep up with my academic achievements, because a lot of time I have to maintain a mindset that whatever I'm learning now is not to really get the academic grades, but more of to really absorb what I'm learning so that I can apply them to the clinical setting to really help my patients.
For me, it's about learning how to manage the commitments between the academic side as well as the non-academic commitments. Because for myself personally, I'm in NUS fencing, so there is a need to balance between them.
So I actually did some recreational badminton, and I actually joined the student management committee as well to help plan events for my cohorts.
Self-care very important. I think making sure you rest, give yourself breaks, pace yourself well. Don't try to chong everything last minute. You will get very tired very fast, and then you realize that you have project after project after project and you will never stop. Yeah.
So for me, it's just simple: food and sports, these two.
I really like to plan ahead. So when I have any important deadlines, I will keep them in mind and really plan when I should start on them to prevent overshooting the deadlines.
I think one tip is to work with a group of friends, because I think dependable friends are important, help you tide through difficult moments in university. Another thing is about prioritizing our work.
So for physio, I guess the most common misconception is they are actually masseuse.
Thank you, Li, for the sharing. We'll come to a time of Q&A. So we'll start off with the first question. What is the interview process like? How many rounds of interviews are there? And is it like the Singapore Institute of Technology MMI interviews? So MMI is multi-mini interviews.
Yeah. Okay, thank you, Serene. So in terms of the interview process, I shared a little on the timeline earlier. So once we receive your application, if you find you suitable, you actually have to go through one round of interview. It will only be one round panel interview, and then because of the current situation, most likely it could be but it will be a virtual interview, but there may be an option for physical interview as well, depending on how the restrictions go in the later part of this year. So it's not like the SIT MMI. We only have one round of panel interview, and then within the panel there will be representatives, senior healthcare professionals from like hospitals or public healthcare institutions, and then depending on which discipline they're applying for. So for example, if you are applying for a nursing scholarship, there will be a nurse in the panel as well. So they will be asking you profession related questions to test you on your knowledge on nursing or the specific discipline that you're applying for. Then there will also be a HR manager or HR person to sit into the board, and there will be a scholarships officer as well. So for example, Serene, myself, and Nigel, whom we have met, if you've joined other activities, will be one of the panelists. So we'll ask you questions like what do you know about the discipline, why do you apply for the scholarship, and etc. Yeah.
Thank you. The next question we have is, what if we can't find any internships during the current COVID situation? Will this affect our chances of getting the scholarship?
Okay. Thank you, Serene, for the question. We do note that in the previous years before COVID, having attended an internship or even like a short job shadowing 2 weeks or attachment actually helps individuals or students to really understand more about the discipline itself, because you may not be able to get all this information readily on the internet through your own research, and seeing it in person is the best way for you to really get a feel of whether you would like to do this as your career or not. But I would say that this would not affect your chances during the COVID situation, because we do understand that the priority of the hospitals as well as the healthcare institutions now are really ensuring that the safety of the patients to prevent the spread of the pandemic. So there have been increased restrictions as well as a higher level of safety precautions that they need to put in place, which may limit the number of opportunities available for internships and job attachments at this point. Uh, if you are a student who are still in like your year 1 or year 2 and you like to um, look into internships or job attachments, you may still have some time in the runway. Perhaps perhaps at the end of the year, you can look into it, whether depending on the COVID situation. But if you are already waiting to go into university or applying for your course right now, I would say that if you are unable to have, or if you have not had the chance to attend any internship or job shadowing, events like our healthcare scholarships virtual experience are events specially set up for students like yourself to understand a bit more about the healthcare sector, the healthcare system, the careers available. And then we also have invited professionals as well as school university partners to share more about these courses and the disciplines, the career pathways available. So our videos are available for playback. If you were not able to attend them at the specific timings, you can actually just go on our website and look into those videos. And we did have quite a bit of questions from the audience. So the interested students actually post quite a lot of questions regarding to certain disciplines and can actually find out on their own. And besides these resources that are available, I also encourage you to speak to people whom you may know who are in these career paths. So some of our healthcare professionals were very kind to provide their contact during their sharing, like they indicated their email. So if you are really very interested, you may want to get in touch with them to find out a bit more about what they do as perhaps like a nurse or a physiotherapist, etc. But do contact them with purpose in mind. Don't contact them and spam email them or what, because they are very busy people and they are on the front line in the healthcare institution. So do ensure that you know what you are trying to find out, and ensure that you are polite and in your interactions with them as well. Yeah, thank you.
Thank you, Li Ying. During my bond, will I be rotated amongst the various healthcare institutions?
Okay, so for this question, in your scholarship application, you'll actually be asked to rank your preferred healthcare clusters. So it will be NHG, NUHS, SingHealth, or if you're applying for the community care or community nursing scholarships, there will be an AIC option as well. You will actually be allocated one cluster through after you're awarded the scholarship, and within the cluster they will allocate you to a specific healthcare institution. So this can be, for example, under NHG could be your TTSH, it could be your KTPH, and then NUHS they have Ng Teng Fong General Hospital, they have NUH, etc. So you will actually be you'll receive a specific allocation to a particular healthcare institution, and you're expected to serve out your bond in that particular healthcare institution during your bond period. Yeah. We do try to allocate students to their preferred clusters, but depending on the manpower needs, you may not often get your first choice, but we do inform you of your choices lah. Yeah.
Okay, we have the next question regarding the scholarship application. So
Okay.
for the scholarship in general, minimally, we must have good CCA skills. But for poly graduates, may I know what's the minimum GPA score we need to have in order to qualify? And I also do note that I saw some another question regarding the outstanding academic results for A-level students too. So are you able to advise more on that?
Okay, so let me touch on poly GPA results first. So we are looking minimally at 3.5 and above, upon 4, and you have a diploma with merit, that would be even better. So that's the kind of academic standard we are looking at if you are from a diploma background. For A-level students, I would say that it largely depends on what kind of healthcare courses that you're applying to. So for example, for pharmacy at NUS is a very competitive, very high academic cutoff points. So you need to have your A's or even uh, mostly A's, perhaps only like 1 or 2 B's to get into the pharmacy course. But for certain other courses, you may not have to have straight A's. You may perhaps get some A's, some B's, or even some C's. So this will depend on what kind of course you are applying to. And for NUS and SIT, I think they do release some cutoff grades that for A-level students which you can look into on their website. So if you want to find out more specific to the discipline, then I will encourage you to go to the university's web pages to look into it as well. And I would say that academic results is one of the considerations that we have for our scholarship applicants, but we do take a holistic review of scholarship applications. So we do not just look at academic results. We look at your CCAs, we look at whether you've participated in certain healthcare related activities or volunteering activities, as well as you usually have to write a short paragraph or few paragraphs of yourself when you want to join healthcare in your application, and we do review this as a holistic part of the application. Yeah.
Thank you, Ling. I also note that you are an overseas scholarship officer. So can you tell me more about how what aid does a scholarship officer do with, because we understand that when overseas scholars actually go overseas, sometimes they are a little bit homesick, they can't adjust to the culture and the food overseas. So what is your role as a scholarship officer?
Okay, I would say that right before even they go overseas, we do have some we do provide them with certain information as well as guide to surviving overseas. So in terms of accommodation, we do point them to the right direction where they can like certain if they need to have bank accounts, set up bank accounts in overseas, we do recommend certain places, and we actually connect them with their seniors before they even go over. So these seniors are, I would say that these seniors are actually the ones with the most applicable knowledge which they share for their juniors. So we have a very strong senior junior buddy system where I connect the senior scholars to the juniors, and then the seniors will actually like guide them, orientate them, tell them where to go if they need to find food, or where are the nearby places that they can check out when they are overseas. And in terms of after they start school, if they do feel homesick, the scholarship, I would say the scholars in the overseas universities have a very close knit relationship, as well as they are pretty bonded. There's also the SHS chapters overseas available, like in Australia and the UK, and they do come together quite often to participate in activities together. So you wouldn't feel that you're alone in a overseas country, and there are people who actually support you during your time overseas. And of course, if you do feel homesick, technology is so advanced right now. People just have a Zoom call and can get in touch with your family members and your friends. Yeah. And during the summer holidays or perhaps their winter holidays, they do come back to Singapore, and we do have a catch up with the scholars to see how they are doing. And then there are also opportunities for these scholars to take up vacation attachments when they come back from their overseas studies, because we do understand that certain courses overseas may not provide the best healthcare context, because if, for example, if you're studying in Australia, you're actually learning about the healthcare system in the Australian context. So to aid them into moving towards their transitioning to a career in Singapore, we do have vacation attachments for them to understand and get a head start, like where they will be working at next time. They get to know their colleagues earlier before they even start work, to help them assimilate into the environment next time. Yeah.
Thank you, Ling. On a related note, due to COVID-19 travel restrictions, are overseas scholarships still supported for this upcoming 2021 cycle?
Okay, yeah, I would say that overseas scholarships in general are still supported. So because you've seen me talk about the health science disciplines, some of them are not available in Singapore because these courses are so niche, and not actually in worldwide, not many places offer these courses. So there is a need to join attend these courses in overseas universities. So one thing I would say that at MOH, we've been partnering with these universities for quite some time, and even during COVID, we've established a partnership with them. And for some of our scholars, when they have returned to Singapore due to COVID-19, they were able to continue with their studies remotely. So they are attending lessons like through Zoom, etc., and they can continue with their studies as per normal. Or there may be certain disruptions, but it is not causing them to stop their studies entirely. So we do see that there should be overseas scholarship in the upcoming cycle as well. But I would also like to caveat and say that it depends on which courses and which disciplines, as well as which universities, and how can the university provide alternative options if by then you are not able to travel overseas to the particular country or university to start school. Yeah, we will work with you as well as the university to find suitable solutions. Yeah.
Thank you, Li Ying. I would just also like to add, because in the recent last year during the heat of the pandemic, when our scholars were overseas in Australia, UK, Ireland, and the situation in those countries weren't too ideal with regards to the COVID-19 number of cases. So our managing director actually made the decision to actually call all of our scholars back, because due to the safety, because we have our scholars' best interest in heart. So our overseas scholarship officers actually had a few days actually just to coordinate, ask the scholars to book their flights, come back and actually try. There were a lot of things happening at that point of time. So our overseas scholarship officers, they had to help them give them opportunities to learn remotely. So whether learning it locally in Singapore, whether there's any clinical attachments that they had to do. So actually overseas scholarship officers actually liaise with our public institutions in Singapore to actually try to come up with these clinical attachments. When they came back, we actually had this a Zoom session to actually check in with how they are feeling, to actually get to know whether was this whether they had anything with regards to Zoom that with regards to COVID-19 that they were feeling very stressed. So I would just like to emphasize that with MOH Holdings, you do have a scholarship officer that is tagged to you. And it's just an additional arm of support, whether is it you're pursuing it locally or overseas. There's always this contact person that you can go to if you are feeling stressed, you are facing some issues in your university or home life. So there's always an additional arm of support for you. Do you like to add anything to that, Li Ying?
Yeah, I would say that, regardless whether you are a student studying overseas or locally. So for example, myself, I am mainly taking care of overseas scholars. So, but Serene, she's taking care of local NUS pharmacy students. You will have a contact point at MOH as a scholar who is a scholarship officer, and this person will actually support you throughout your course of studies and even after you start work. So anything related to the scholarship that you have inquiries, you can write into us. And if you face any challenges, we may not be able to give you the solution for everything, but we will try to point you towards the right resources where you can do some self-help or get help from someone, a suitable person, the right person. Yeah.
We have a few questions regarding healthcare administration scholarship. So we do have a scholar speaker, Clarence, who will be coming up from 11 a.m. onwards to actually share more on his administration journey. But before that, I would just like to address some questions. So the first question would be, what is the career progression for healthcare administration scholarship recipients?
Okay, I would say that because healthcare administration scholarship recipients can come from different backgrounds, so depending on what you study, in general, I would say that it's a pretty straightforward career progression. So you will still start off as like a junior level, perhaps like executive or position in the specific institution that you've been bonded to, and then after a few years, if you do well, you get promoted to perhaps like senior, and then you'll get to move into specialist track, depending on perhaps if you are like a data engineer, data scientist, or you can move into managerial roles, etc. So I would say that in general, that's the career progression, and we do see some healthcare administration scholars coming from various backgrounds. So some are in finance, some later you'll hear from Clarence who is at IHES, the IT related courses. And then we do see quite a number in operations as well. So it depends on what you study and what you're interested in, and you can get to work on it as your career after you graduate. Yeah, we do understand that the healthcare administration scholarship has quite a number of pathways, and people don't really know what exactly they do or where they go. But we have interviewed quite a few scholars from the healthcare administration scholarship, and we've posted articles on them on our Facebook and Instagram, so you can actually go on our social media to read up on them. They do come from different backgrounds and can actually find out what they studied, what they're currently doing right now, and how they actually play a part in the healthcare system even though they are not working in the front line. So it's quite interesting. You can go and take a look. Yeah.
Okay, next question. Are there any preferred disciplines for healthcare scholarship administration scholarship, sorry. Do some courses make one more likely to get the scholarship as they are more relevant to the needs of the department?
Okay. I would say that there are a few that we see more often. So for example, IHES is one of the partners in the healthcare administration scholarship. IHES is the Integrated Health Information Systems. This is an organization that take care of the health IT systems for the entire public healthcare sector. So we do see graduates more from I would say like computing, data science backgrounds going into IHES, or even computer engineering, etc. Then we do see quite a number of students from finance background as well. So they work in corporate functions in the healthcare institutions. Yeah, I think and quite a few as well. But I would say mainly because of the boom in IT, we are also seeing an increase in terms of the students studying IT, applying for healthcare administration scholarship. Yeah.
Thank you, Ling. Moving on to you being an interviewer during the scholarship interview. So is there any specific qualities that you look out for in a scholar?
Okay, I would say that in general for potential healthcare scholars who come for interview, we are looking at individuals who can display qualities and values such as compassion and empathy, because in a healthcare career you will encounter patients from different backgrounds. Some of them can come from very difficult backgrounds. They may not have the money to seek medical treatments, or they may be suffering from very severe illnesses. And as a healthcare professional, when you come into contact with them, when you interact with them, you you need to be able to be in their shoes and understand what they are going through, and then at the same time guide them through their process and the journey towards recovery. So for example, if you imagine yourself being a patient who is suffering from a severe illness, do you want someone to talk to you like a robot with no emotions, like, oh, sorry, you've got cancer, and then that's it, and then you need to go through step 1 chemo, whatever. Of course you would like someone to treat you with tender loving and care, so that it makes you feel better even though you are physically not so well. And we also are looking for candidates with good communication skills. I think that's very important, like I mentioned earlier. So in healthcare careers, you will definitely be working in interdisciplinary teams. For example, if you're a patient, if you go to a hospital, you realize that you don't just see a doctor. A nurse will take care of you during your stay in the wards, and then if you need certain therapy, uh, rehabilitation exercises, you will actually see your physiotherapist, you will see your occupational therapist, and then when if you have any finances or if you have any difficulties in terms of discharge care, the medical social worker will actually step in. And then in terms of medication, the pharmacist will actually guide you, ensure that you know what you are taking, and ensure you know that certain medications are not supposed to be taken together, etc. So you actually work in an interdisciplinary team and with many other people, and you will also interact with a patient, their family members, their caretakers. So there's a lot of communication involved in such a career. So you need to be able to be comfortable in communicating and working in a team in healthcare career. So I would say that these are the qualities that I'll look out for if I were interviewer in the panel. Yeah, but most importantly, you will need to display a good knowledge of the discipline. If you are coming and you apply for pharmacies, but when the interviewer asks you what does a pharmacist do, and you can only you don't really know what a pharmacist does, then it doesn't show well on your application as well. You didn't do your research before coming, you didn't do your homework before coming. So do read up on the specific disciplines and ensure that you know what you're getting into, because a scholarship you will need to study for a period of about 4 years, and then there's a bond period of 4 years to 6 years. So in total it could be an 8 to 10 years journey. You want a candidate who really know what they are getting into when they come for the interview.
I also would like to add one more point. So it's really for students to be very genuine in their answers, because we do note that sometimes you come in with pre-prepared questions and you think that you need to give us the very model answer, the very standard answer that we are looking for. But actually, most of the times we are just looking for someone who is very genuine in why they actually want to pursue this career, why they want to take up this scholarship. Yeah, so we are not looking for your fancy words. We are not looking for very good resumes and everything, but we are looking for someone who's very genuine, because being in a healthcare sector, like what Li Ying states, you really do need to have the heart for people. You do need to be genuine in your interactions too. Yeah. So I'll ask Li Ying her last question. So the last question would be, can we apply for more than one scholarship if we are applying for both non-healthcare related and healthcare related courses? So if I'm not wrong, I think this person would like to apply for the healthcare administration scholarship and maybe the healthcare merit award or community care scholarship. So, and the second part of the question is a teacher recommendation required for any scholarship?
Okay, so for the first part of the question, I guess is about applying for more than one scholarship. You can apply for more than one, but after shortlisting the applications, our selections team members may contact you to ask you to indicate a preference, because every interview board is specialized for a specific scholarship scheme and a specific discipline. If you're applying for healthcare related courses. So for example, if you go for an interview board for a healthcare merit award or community care scholarship, it will be specific, like for example, if you apply for occupational therapy, there will be occupational therapists in the board, so it will be specifically for that particular discipline and for that particular scholarship scheme. So at that point in time, our colleague will actually ask you which one you would like to be prioritized and which one you prefer to be shortlisted for, if you would like to consider you. In terms of teacher recommendation, I would say that it's not compulsory, but it will be good to have, because you can actually get your teachers, not just your teachers, perhaps someone who knows you well in a professional setting. Could be some organization that you have volunteered at, or if you have gone through internship for like the polygraduates, or even A-level students who've gone through some kind of work experience. You can get your supervisor then to write you a recommendation letter. It is not compulsory, but we do look at it and see how it helps your application. Yeah.
Thank you, Li.
Yeah.
Do you have anything else to add?
No. Not just teacher. I wanted to say the last thing. Your CCA teachers as well. So maybe if you've done very well in your CCA, you take up leadership positions, you can get your CCA teacher in charge to write you something nice as well. Yeah, that's all.
Thank you, Li Ying, for sharing more on making a difference with healthcare scholarships. We now come to the Scholar Ambassadors panel dialogue. We would like to warmly welcome Ms. Tiffany Toh, who's studying medical social work at National University of Singapore, Ms. Chu Ki-Gek, diagnostic radiography, studying at Singapore Institute of Technology, and lastly, Mr. Clarence No. He is a senior specialist currently working at Integrated Health Information Systems. We will first start off with Ms. Tiffany Toh. Tiffany, please.
Good morning, everyone. My name is Tiffany, and I'm a healthcare scholar under MOHH. I'm currently studying in NUS and pursuing a degree in social work to be a medical social worker in the future. And I'm posted to Sing Health after 4 years in NUS. So I was from the normal acad stream and later moved on to the Polytechnic Foundation program for a year. And after that, I did my 3-year diploma course in gerontological management studies. So throughout my experiences and 4 years in Poly, it really sparked my interest in social work. So here I am today. Okay, so what's medical social work? So here's just a short summary that you can read through. But I think what I really wanted to highlight is that beyond just looking at the patient's health, we also look and assess their overall well-being so that we can refer them to the right resources to integrate them back to society after they are discharged. So as social workers, we look more at the individual as a person, what they need and what they lack. And what I really enjoy so far, as I study to become a social worker, is really learning how to put on the person-centered lenses that we have to wear in the medical setting, where we relate to our clients as individuals and not just as patients. Okay, something more relatable to you guys. So currently I'm year 2 in NUS, and being a scholar, I was exposed to many opportunities that many of my peers might not really have. Additionally, when we go into a new environment, it's quite scary to join new things. So I was quite afraid to join things in school. But as a scholar, I was given many opportunities to join events and also plan them. So here are some examples. The circled ones are those that I was more directly involved in. So firstly, I was in the Singapore Healthcare Society as one of the publicity excos, where I formed things like Instagram captions. I did this mini lookbook to show off the healthcare scholarship. So, this kind of creative side of things. And the Singapore Healthcare Society are a group of scholars who help local scholars to be linked together to provide activities and resources. And it's also an area where you can learn to grow your leadership skills. There were also many volunteering opportunities given to us, such as the one I attended, which is a volunteering event at Rensi Hospital, where we got to play games with the elderly, sing karaoke songs before the pandemic. And talking about the pandemic, even though we were all stuck at home, as scholars, we were still given opportunities later in the year to actually celebrate festive events on Zoom with different organizations. So as an MOHH scholar, such opportunities are always available, and these are really stepping stones in gaining more experiences and meeting new people. And we are also exposed to many different talks, such as the financial literacy talk, which is something you don't really go for on a normal basis and is super important for adulting. Yeah, another recent event was actually meeting my future workplace colleagues. It was very enjoyable because it brought me a lot of comfort to see how welcoming the environment was. And as a scholar, we also have the opportunity to meet them, whether is it through Zoom or even physically when in the future when things lighten. Yeah, so meeting them to even ask questions to get to know what is it like working in the organization that you are posted to. So this really brought a lot of certainty for my future. And so with all these opportunities given by MOHH, I can enjoy studying as I have a clear direction ahead and I know what I want to achieve in the future. So when I study in school, different modules that we have, I can clearly see how I can apply the practices and theories in my future workplace. And these opportunities and exposures have also allowed me to be a more effective person and student. On top of that, as a social work major, I also have opportunities to visit social work agencies to apply the skills I've learned, like group work, and also work with real clients. On top of that, I'm also in a CCA called the Peer Student Supporters in NUS, where I get to apply skills I've learned to support, peers who come to us when it reaches stressful periods of times. Yeah, and these are also opportunities. There are also opportunities to plan events which you guys will have heard of, like the Freshman Orientation Program, which I was part of last semester. So with all these opportunities, as both a student and a scholar, student life really is much more vibrant because beyond just academics, there is always a chance to challenge ourselves and have a continued growth as a person. And at the beginning, I also shared a bit more about my academic background and my journey so far because I wanted to encourage everyone that if you work hard and you also put your hearts into what you want to learn and achieve, you will get to where you're called to be. And I'm not sure what everybody's backgrounds are, but I think coming from a normal acad background, getting into uni, and let alone being offered this scholarship really seemed super impossible back then. But I think really nothing is impossible. And one thing I learned as a student and as a scholar is that grades are not everything. Yes, it's still important to do well and to be excellent in all that you want to achieve and want to do. But I think it's also important to enjoy your time as a student, to challenge yourself, join events, and meet new people, which was what I got to do as a healthcare scholar. So if there's really an area you're interested to go for and have a passion for, I encourage you to try it out, to take that step of faith like what I did. I really didn't regret this journey I'm on as a scholar. And something I always remind myself through uni life is that if you have a passion for it, just go. Life will get you to places where you're called to be at. Thank you.
Thank you, Tiffany. We'll now like to pass on the time to Kigit. Kigit, please.
Okay, hello everyone. I would like to introduce myself a little here. So, as what was mentioned, I'm Kigek here. So, I'm an MOH scholar and I'm bonded to NUHS Health Cluster. Currently, I'm studying at the Singapore Institute of Technology, in short SIT, for the course of diagnostic radiography. And what is exactly diagnostic radiography? Basically, we learn how to handle sophisticated equipment to help the doctor to obtain diagnostic informations. So for the doctors to make clinical decisions and treatments for the patients. To people who don't understand our professions, they actually think that we are just button pusher, meaning that we actually press the button that expose radiations to the patient to obtain an image, just like a photographer. So, and that is our job, not necessarily. Actually, our job is more than just that. We are the patient's advocate. We have a duty to protect our patients using our knowledge in the equipment. While operating the equipment to obtain the best diagnostic images, we are also at the same time need to try our best in reducing the radiation dose to our patient. And not only just that, we also need to have the practical skills and the technical skills in positioning of the patients for the different types of x-ray. For example, the knee x-rays. Okay, so in diagnostic radiography, there are more than just x-rays. So there are specialized modalities like MRI, CT, ultrasounds, mammography, and many others we can specialize on as a diagnostic radiographer, and each modality is unique in its own way. So recently I had just completed my first specialized modality attachment, and I must say it's really an engaging sessions because I got to learn different modalities. For example, in CT imaging, so which uses radiations to create 3D imaging, you get to see a more urgent care patients such as trauma cases. And for those kind of cases, you really needs to be on your feet and go on with the paces, and it's very fast paced. So on the other hand, contrary, so in MRI, where we uses sophisticated physics principles to create 3D imaging, so it's a much slower pace as compared to CT. So there are different modality that that look at different things, and that give us a different environment as well to work on. So if you have the passion in such area, then you should come to diagnostic radiography to explore your career here. So last but not least, I would also like to share some words of advice here. As a scholar, there is of course some academic requirements for us to meet. So my advice would be not to just study because you need to meet the criteria as a scholar or pass the exam, but study hard because you want to be the best for your patients. So in that way, you'll be able to enjoy your study more. So I hope that you find my sharing useful, and that's the end of my sharing. Thank you.
Thank you, Kige. We'd like to pass on the time to Clarence. Clarence, please. Sorry, Kige, you have to unshare first. Okay, thank you.
Okay, hi everyone. Morning. I'm Clarence Ngor, and a bit different from I think the presenters earlier. I'm actually a Singapore Industry Scholarship scholar, and I actually got awarded this scholarship all the way back in 2012. My discipline is actually not in healthcare, but I studied information systems, and that is learning how to build software systems. And later I'll share a bit more about how this is related to healthcare. But just a bit more of my journey. After I did a information systems undergrad at SMU, I went to Carnegie Mellon to pursue my master's, and then finally I joined IHIS as a data analytics in the data analytics team. So a bit more about IHIS. We are actually Singapore's health tech company, and I think we serve all of these public hospitals in terms of their IT infrastructure. But at the same time, we have a bigger vision of trying to digitize connect and analyze Singapore's healthcare information, right? And that I would touch on a bit more about some specific examples. Okay, so as you know, my specific area of focus is in data analytics. And when I joined IHIS in 2019, one of my initial focuses was trying to build up and bootstrap this data analytics platform to serve healthcare analytics projects at the national level. So I think answering the question, how does data analytics actually tie into healthcare? I think there are many examples, especially with the recent COVID-19 epidemic. We actually had to rely a lot on data to deal with the sudden volume of COVID-19 cases, and a lot of our decision making is based on data. So just to touch on a few examples that I was personally involved in, we actually back in March, we helped CGH, right, to work with the diagnostic radiographers to deploy some AI tools to help to predict the severe onset of pneumonia. Okay, this is the first picture you see over there. I think as the IT team that supports all these operations, we work closely with the clinicians, like similar to what Kigek was sharing earlier. It's not just about button pushing, but also about how we constantly innovate on these processes to deliver a better patient journey for our stakeholders. Subsequently, there was also this explosion of cases, and we had to quickly set up many mobile hospitals. We call them the community care facilities. So as part of the effort, I also was involved in helping to build up the data infrastructure to help to get these patients to do the vital signs monitoring. So a lot of all these events were actually processed automatically rather than being read by individual clinicians. So that really helped us to scale up a lot. And this is really a great example of how data and also automation can be used to supplement our healthcare workers' efforts, right? And to deal with such large-scale spikes in healthcare demand. So currently, I'm the operations technology lead, working on the COVID test repository project. So the COVID test repository is actually a single source of truth for all of these COVID results. And what we actually do is when these lab results actually get contributed to us, it actually triggers downstream actions like contact tracing, quarantine, and most of this pipeline, even though we still have humans in the loop, I cannot imagine a scenario that we can survive without this spike without having technology to support us. So that kind of sums up my journey in IHIS, and I'll be happy to answer any questions as well in the next segment. Thank you.
Thank you, Clarence. I would like to invite all our panelists back on for the Q&A panel discussion. Hi, Kigek. Yeah, thank you. Okay, the first question is for Kigek. So what do you think is the difference between diagnostic radiography scholar and a non-scholar, probably in terms of your school life, in terms of your extracurricular activities, things like this? What do you think is different?
Personally, I think as a non-scholar, the opportunities offered in our school is equal on the ground for scholars and non-scholars. So however, there will be more opportunities of exposures when you're engaged as a scholars under MOH. So under MOH, in terms of the MOH side, they will have a series of events and activities that as a scholars we can participate in. So our school side is an open ground for both scholars and non-scholars. So being a scholar would be more beneficial as a diagnostic radiographer because you get to benefit both sides of the events, and then you get to open your eyes, able to see more things, I would say. Yeah.
Thank you, Kiki. Is there any particular scholarship event that you have attended that has a memorable impact on you?
I would say yes. there was this particular scholarship. It was just a pre-orientations for all the scholars to come together to do some volunteering work to the neighborhood. So I would say particularly it was quite memorable because we get to go down as a group of scholars to the neighborhood to do some health screenings for the elderlies who are really not really of a well-to-do state. So they are like singles, elderlies, they live alone, they don't have anybody to talk to. So we actually we went down and then we do health screening with them and then provide some comfort and support, which my school in this area not so much into this kind of area lah. Yeah, but we do have volunteerism in activities in our school, but there are more than just that in MOH. Yep.
Thank you, Kiki. So now we move on to Tiffany. So Tiffany, have you gone for any of your attachments, your clinical attachments in school?
Not yet, but we visited and like we went to the cluster, then we followed a social worker around. Yeah.
Okay. Will you be able to share more on what is a medical social worker's daily job scope?
From what I can remember when we tagged along with the medical social worker was that she shared how they will visit the clients under them, so the patients who are staying in the hospital, then the medical social worker will visit to just check in on them to assess their overall well-being. And overall well-being means like not just their physical but their mental, their emotional state, and every aspect of the person. Yeah, and then to see if there are areas where extra care is needed, so linking them to the resources that they need, whether it's financially or even community services that they can tap on after they are discharged. Yeah, and also providing like counseling and like just being there to listen with them throughout their stay in the hospital. Yeah.
Thank you, Tiffany. So we move on to Clarence. I think they do have quite a few questions for you. So administration is quite a broad field, and whereby you can go to any industry. So whether is it hospitality, you can go to the banking industry or tech companies. So why did you choose to go into the healthcare industry?
Yeah, I think definitely. I think technology is super hot now. I think for those that have just done their A levels, you know that I think compared to 10 years ago when I first came in, the profile of going to tech careers has really shot up in recent years, and I think in my personal opinion, health tech is going to be much hotter in the next 5 to 10 years. And I think maybe just to give you an example why, you just think of all the essential services that we consume today. I mean, we as individuals, as Singaporeans, right? Think of those essential services and you think about which one is the most, I would say, lagging in terms of adoption of technologies, right? You look at the banking space, we have a lot of consumer applications. You can do investments now on your mobile devices, right? And that has led to the huge explosion of demand of all these technical technical specialists. But in healthcare, right, we are trying to move to that direction. And with the aging population, with more people needing to not just visit healthcare services when they are sick, but to see in a broader perspective of maintaining the wellness over your lifetime, right? We need technology to also provide those customized, personalized services to the individual. So I think I hope this paints the picture of the opportunities available and also the amount of catch up that we have to do in order to one day you'll be able to access high quality services, just like Amazon. You can click and get packages to your doorstep. You also want that same level of service in healthcare, and I think that's the big picture. And I hope that would excite people who are considering a career in technology, that they will consider healthcare as one of the starting places to look at.
Thank you, Clarence. I have a question to the panel. So maybe more for Tiffany and Kigik because it's they have done their interviews during the recent years. So how can I better plan and plan for my interviews, and how do you think what do I need to do to ace my interview? Any tips? Tiffany, would you like to go first?
Okay. I think for me, I think like y'all might be nervous, or you always would want to say the right things. I think like what Li Ying and Serene also shared earlier, they are not looking for like the model answers. So I think when I went there, I also had a list of answers. Okay, I need to say this, say that. But I think when you go there, it's not as scary as you envision lah. As it's an interview, and the people there are really genuinely wanting to know why you want to apply and what you want to provide, in the future in the healthcare setting. Yeah, so I think how to ace is to not just keep focusing, okay, I need to get this scholarship. But I think essentially, if you have a passion in the healthcare sector, right, whether you have this scholarship or not, of course, having it is a very, very good thing. But I think to just remember to just do your best and to not keep focusing on the end result. But I think it's also the process of learning more about yourself and just being confident. So I think confidence is one of the main things that help me to be confident in yourself, to know what you want and what you are there for, and then communicating it to the panel of interviewees when you are there. Yeah.
Thank you, Tiffany. Kike, do you have anything to add?
I would say that treat it as a sharing sessions with the panel. So like that, it will be easier for you to pour out your heart and be true to yourself, rather than see it's an interview. I need to do well. They're looking at me. Every word I say is something. It means something. Rather than keep on thinking and drilling on all this, just treat it as sharing sessions. Share your passions. Share your why you want to go ahead with this route, and why is it something for you in it. So share your compassion rather than try to ace it. That's my advice. Thank you.
Thank you, Kige. Okay, we have a few questions for you regarding diagnostic radiography. So the first question is, why did you choose to do your studies locally instead of overseas? And the second one would be, for once you have started working, which year do you start specializing?
Okay, so for the first questions, why I do it locally, actually I have both options. I have both options of doing it locally or overseas, but I actually prefer locally because my families are here, my friends are here, and I'm just not an overseas person, even though like it is a wow factor for me to go overseas. But I think that SIT program is quite stabilized and well established as well. And then it's not yes, I would say SIT is quite a recent school that started allied health programs. But I think throughout all these years, diagnostic radiography has been well established in Singapore through the Ngee Poly, the route. So I believe that they closed down the Ngee Poly route so that they can make a bigger space and more established program, so to accommodate more diagnostic radiographers. So for that, I think SIT would be enough for me to be accredited for this program. So therefore, comparing to the overseas and the non-overseas choices, I think they are both equal, and also based on what you're looking at. If you want a more exposure, more overseas exposure, you want to see overseas healthcare, being provided versus how Singapore healthcare being provided. Overseas is definitely a better choice, but ultimately you will be bonded back to here. So Singapore healthcare system is much more of a priority to me to understand how they works. So therefore, I chose locally and in SIT. And for the second question, after you started work, it depends on the institutions that you work in. So some institutions allows you to specialize in 1 to 2 years time. So however, some will allow you to specialize in 3 to 5 year times. So it depends on well, what kind of positions are you, and the availability of the modality. Yes, the queue up for the modality. So I would say that there is no limit or range that you can quote for lah, in this case. Yeah.
Thank you, Kigate. We'll proceed on to Clarence. Clarence, I think just now you briefly touched on the future of health tech in Singapore, but are you able to elaborate more on what the upcoming things we can look out for, so to excite our future students who actually want to come into the healthcare industry, especially through the administration route, the technology route? Yeah.
I think that's a big question actually. I think, I mean, for everyone to think about as well, what would they like to see in the future of healthcare? Because after all, healthcare is, I think, for the individuals and also for for the people that you care about, right? I think one of the things that we have been building up in the past couple of years is all this, bringing healthcare to the mobile devices. And I think right now, if you were to visit the polyclinics or any of these specialist outpatient clinics, you'll be able to access your lab reports, your appointments on a mobile app. And also recently, we were able to also access your family's health records on the same application. So definitely look out for more coming in that space. But I think at the overarching level, right, Singapore has one of the most cost-effective healthcare systems in terms of the outcomes that we provide. And I don't think we can take this for granted. There are a lot of logistical challenges, system optimization that need to be done. There's a lot of what's the word? Roboticized. Okay, basically putting robots to work for us. And I think now you see in the hospitals, for the dispensing of medications, whatever that we can automate, right, such that pharmacists can actually focus on actually the patient interaction, right? So another big area is in terms of how do we reduce the workload of nurses at the wards, right? Today, that nurses have to do a lot of documentation. We have to key in all when they give you the medication, and there's a lot of that you see all of them behind the computers. We would actually like to have them have more time to be not in front of the computer, but in front of the patient, actually providing you with that care. So at the systems level, I think there is a lot that can be done as well. But all these would require not just the efforts of IT specialists or software engineers like myself. It is actually a whole team effort, with all the various healthcare disciplines, with the doctors, with the healthcare administrators, I don't have all the answers, but I'm happy to bring this perspective of how can we use software, systems engineering, optimization to help solve some of these human problems on the ground. So so going, not a direct answer, but I hopefully seed some thoughts in some of these young ones to think about, brainstorm new ideas, and we'll be happy to hear them.
Thank you, Clarence. I also just like to add that I remember last time when I was still in secondary school when I have to when I was sick and then I went to polyclinics, we usually need to wait for a very, very long time to get from registration all the way to seeing the doctor. But now in recent years with the Health Hub app, you can just book an appointment and you can probably see the doctor, get your medication, and be out of the polyclinic within an hour. Everything is so fast, very efficient, very technology based also. And these are some of the types of examples that you can see how technology has helped us, how technology has complemented the works of healthcare workers. And we also will be seeing a lot more of such technology and innovation in our daily lives also. Yeah, thank you, Clarence. We do have another question for you. So what are the challenges that you have faced in this current pandemic in this field, and that you have you found it hard to overcome at that moment, and how did you overcome that? Sorry, question for Clarence. Yes, yes. So it's okay. I can repeat the question again. So, what are the challenges that you have faced in this current pandemic in your current field? How did you find it hard to overcome at that moment, and how did you overcome it?
Okay, so pandemic, right? I think the situation for IHIS is the same as for the ministry and for all the hospitals. We are dealing with a sudden overnight explosion in demand, and that requires setting up new systems, training people, just getting everyone organized to know what to be doing. I think it's a huge effort. I wouldn't say this is just my challenge alone, but at the initial days, of the pandemic, a lot of things were very fluid. So previously in software engineering, we were very used to having planned requirements gathering cycle. You have time to build, test your application, and then go live. But when we are talking about dealing with a pandemic situation, a lot of this has to be accelerated and done in a very agile way. So I think that was one of the cultural things that we have to adapt to. Not everything can be perfect, but we don't strive towards. The goal is not perfection, but the goal is to progress and do a continuous improvement. I think in the initial days as well, there were so many parties really, pouring in their efforts into the COVID-19, response efforts. It was very confusing landscape at that point of time. There were so many different organizations, so many different acronyms that you kind of have to, work with. But I think, going back to continuous improvement, it's not, although this idea came from software engineering, right? I think I also see it being applied in terms of processes help, right? And over time, the different tracks of people working on COVID, we actually had to, continuously negotiate about, okay, what is it that you're doing? What is your value add? What is the part that I can take over and do better? So there's a lot of this reshuffling of work that happened behind the scenes, right? To optimize, eventually we're trying to ensure that the patient journey for COVID-19 patient is smooth, right? From when they get swabbed to when they get finally discharged, right? So yeah, I think that's the main way we overcome any challenges. We can't overcome it overnight, right? But every day we take a look, take stock of where are the bottlenecks, and then we try to optimize and improve them. Yeah, but we are definitely still hiring a lot of people. Now COVID is kind of coming down, but there's this new vaccination operations, and we are hiring a lot of people to come and help us and give us the support we need.
Thank you, Clarence. Questions for Tiffany. Can you share more about the community services and resources which you link clients to? I do understand that this is only after you have started working, but during your course of studies, do you know about the community services and resources?
Yeah, there's actually a lot to if I were to list, but I think maybe I'll just name a few common ones. So I think a lot of times when after you assess what this the patient needs after they get discharged. So for example, if this patient has dementia and that her family are all working, so if she were to be discharged and go home, right, the patient will be all alone with nobody taking care of her most of the time. So what resources they have in the community? So for example, if there is a dementia daycare for example, maybe I used to intern at Yong En Dementia Daycare in Chinatown. So I know there is a community there, and if that person happens to stay in that area, so I'll link as medical social workers, we will link them to such resources so that they can seek care and help to be taken care of when their family members are working, because I think these are inevitable things also, being able to being taken care of by the organizations there. And also family service centers that provide counseling if we see a need in further counseling after they are being discharged, and also other services like financial ones where we link them to financial officers, or even government agencies where they can seek the financial help. Or even for students, school social workers, link them to the assistants in schools. Yeah, so I think there's a lot of resources out in the community for us to look at, and so it's really a vast and broad spectrum. Yeah.
Thank you, Tiffany. Can you share more about the difference between a social worker and a medical social worker, if there's any difference?
Okay. Yeah, I think the main difference is, I think like the name suggests, medical social workers usually works in like a medical setting, so hospitals, healthcare settings. Yeah, so a lot of the care and the assistance is usually done in the hospital itself. So yes, we do follow up with patients who have discharged, but I think after they are discharged, most of the direct care by the social worker is done with maybe their community social worker. Yeah, so I think that's one of the main difference between a medical social worker and a social worker. And for social workers, usually they work in areas like family service centers. They can even work in specific care centers, like being specialized in dementia care. So you work as a dementia care social worker or school social workers. So it's more in the non-medical settings as compared to medical social workers. Yeah, but I think essentially both social workers, like both areas, at the end of the day, we still care for the person, we care for their needs, and assess their overall well-being and stuff like that. It's just in different areas and different settings. Yeah.
Thank you, Tiffany. I think similar to the question that I asked Clarence earlier, we note that social workers, you can go into a wide range of services like MSF, you can go to MCCY. So why did you choose healthcare?
I think firstly, the main one was maybe an experience I personally had when my grandma was in the hospital. Then a social worker came to assess, because my grandma has dementia, so it was a bit hard to talk to her, but I think the social worker left like an impact on me lah, to see how he was patient with her and listened to her even though she was like not giving very good answers. Yeah, and I think after I think he also knew our family situation and linked us to the help that we need after my grandma is discharged, and then also checking in on us after she's discharged to see how we are doing. Yeah, so I think that was one of the main impact lah on me, because I saw how it wasn't just like, okay, I discharged then bye-bye, but it was really him following up after that and really making sure that my grandma had enough help outside. Because I think a lot of these services, as like normal beings out there, we are not very sure of, but I think the social worker help us to be very informed with the help that we need and can receive outside. Yeah, and I think also in general, I wanted to pursue a career that helps people and that can be one that journeys with them through like difficult seasons of their life. Yeah, so I think in the healthcare setting, being gone through like my own experiences with family members in the hospitals, I think that's a place where I feel I would want to be a part of lah, to impact and to bring positivity in maybe lives that are not as positive. Yeah.
Thank you, Tiffany. I'd like to open this question to the panel. So why did you decide to pursue your current discipline? So whether it's in diagnostic radiography, social work, or even Clarence within the administration field, why did you decide to pursue this current discipline?
I think for me, it's quite a simple answer. I think you got to like what you are doing day to day to be able to survive the long run. So, I mean, fundamentally, for medical social, you need to enjoy interacting with people, helping them. You need to get a sense of fulfillment. And I think this is quite hard for, A-level or, recent, you just count, so you don't really know because you haven't actually done it. So I encourage you all to, try it first to get a sense of whether this is something you can sustain. And I think for myself, if I back long ago, I really knew I like to build things, build applications. Every time, even in my free time, that's something I like to read, something I like to, do. So for me, that was a very clear choice. But if it's not so clear to you at this point, then definitely do more exploration, right? Before you make any, commitment. Yeah.
Tiffany or Kike, do you have anything to add? No? Tiffany? No. Okay, no worries. We will move on to the next question. What are the expectations do you have as a scholar? So I think this is with regards to expectations from MOH Holdings and also expectations of your fellow peers, your fellow your professors? Do they have this misconception that, oh, since you're a scholar you must be very good at what you do? So that's the part A of the question. Part B is, do you need to maintain a certain grade throughout these 4 years of your degree? I see both of you are smiling. Please feel free to elaborate.
Okay. Yes. When I started my first day in school was very interesting. Yeah. Um. People try to mingle around and ask, "Oh, are you a scholar? Are you a scholar?" So for me, it's just first day in school, so I just trying. Okay, yeah, I'm scholar. Hi, how are you? Then trying to meet, and people will be like, "Wow, you're a scholar! Wow, wow!" like, yeah. Then, like for my friends for my close friends, when they first get to know that I'm a scholar, they felt intimidated. Yeah, they felt that I'll look down on them, that I'm gonna be like yeah papaya, or like I don't want to share my study notes and stuff like that. So like people see scholars very differently, and of course as a scholars you get as a scholars, and of course you get to carry yourself very positively. Okay, in character wise, being positive, being a good person and stuff like that. And that I think generally is expected for all the scholars, not only scholars, for all humans lah. So I think there is no much difference between you're a scholar or you're not a scholar in my school, because everyone is given the same opportunity in learning. If you're slower in learning, even though you're a scholar, so the prof will spend times with you to actually revise with you. And then and as a MOE scholar, I would say that uh we it's just the benefits of the scholars, being a scholars in MOH, that the benefits. Other than that, you are just really a student in my school. And everyone is given the same opportunity in learning, and there's no favor granted just because you're scholars or not. So I think that part is clearly defined in my school. And for us as a scholars, definitely we need to meet a certain grade. So and for it will be very hard. I wouldn't say very hard. I would say that is if you establish well your learning, you know what is your learning style, and then you clarify with the prof and make sure and do some peer learning, approach the learning as you prefer, you will definitely be able to score well. And then if you do have problems, like you can just feel free to approach. Don't just feel that you are a scholar you cannot approach. I do approach a lot of times as a scholar, so don't feel ashamed. I'm a scholar, I should know better, I should be more capable because I'm a scholar. So it's just not that. Yeah, that's my view.
Thank you, Kiki. Tiffany, do you have anything to add?
Yeah, I think to just add on, I think for my own experience in school, for mine it's opposite. Like no one knew I was a scholar. It was until like my friends asked me, "Oh, what you want to do in the future?" Then I share with them, "Oh, actually I'm bonded and stuff like that." Yeah, so I think it really is person to person lah, and what school you're in, and also the friends that's around you. Yeah, because I think for mine, my friends didn't look at me differently. Yeah, it was a really like oh, I'm just a scholar but I'm still a student kind of thing. Yeah, but I think what for me, what was more significant was my own expectations of myself also, because I think I was also always thinking about, okay, I need to do this, meet this criteria. Yeah, so I think that was more of the expectations that I had to face. So my own personal mental struggle and mental like fights here and there, like, okay, I need to prioritize my time and do this, do that. Yeah, but I think essentially at the end of the day, it's really just doing your best as a student and excelling in the different areas that you choose to pursue, and also not putting so much expectation and stress on yourself. Yeah, I think that's very important at the end of the day, to really have that self-care and mental care, so that you are able to be an effective student and an effective scholar. Yeah, and I think, yeah, so that was like the really the main expectations that was on me, which is like my own personal one. Yeah.
Or just like, oh yes, Clarence, please go ahead.
Okay, I'll answer in two parts, okay? I think as a student, definitely you got an advantage, okay? And that's the primary benefit of a scholarship. You have money, right? Your school fees are paid for. You have a stipend. When I was in the US, right, a lot of my peers, right, they had to do like jobs or TA shifts to earn additional money so that they, have money to spend on the weekends. So having money is, I think, a great benefit we shouldn't forget. I think that also gives you a lot of the freedom of time to focus on your studies. I thought that was a big advantage that I had in my schooling days lah. So I mean, as a scholar, you also have to remember that you got all these benefits. How can you use that time to help your peers as well? Mentor them, teach them, work together, share notes, stuff like that. So you receive some, you give some. But I think when it goes to the workplace, right, frankly speaking, no one cares whether you're a scholar or not. Okay, it's all equal already. Everyone is working. We have the same roles. As long as you perform well, you'll get more opportunities. And I think that's where you need to balance expectations. So if you come into the workplace thinking, oh, I'm a scholar, projects will get piled on my plate. Everyone would think you're so smart. Then that's not the case. Most of the people we work with in IHIS are very experienced as well, experienced candidates. You have other scholars as well. The differential doesn't actually make a difference anymore. So that's kind of my take on it.
Thank you all. I would like to just chip in with regards to me being a scholarship officer. So yes, definitely you guys, scholars do need to maintain a certain grade, and what the grade is second upper honors and above. But we at MOH Holdings, it's not like the first semester that you drop below second upper and then you are straight away terminated. No, that's not the case. We'll actually call you in to actually talk to you and kind of find out what is happening, whether is it your studying style that is not correct, whether you need to have better time management, or maybe there's something that happened personally that affected your studies, and then we'll try to get down to the bottom of it, like why aren't you performing? Because when we first awarded you with the scholarship, it's definitely because you have already your academics were good, and so university life you should be able to maintain such grades. So, and in the recent years, we are in partnership with one of the counseling organization to actually provide such counseling tools or opportunities for scholars to actually go and seek a professional counselor to see how they can actually better improve their studying habits also. So it's not a case whereby we are here to, once you go below the academic mark, okay, we won't give you a second chance. There's always going to be a second chance. There's always going to be us coming in to actually kind of find out, give the human approach. We are not here to actually terminate your scholarship. We do not want that. Yeah, so definitely, yes, there is an academic grade that you need to maintain, but no, it is not like an immediate termination if you fall short of the grades. Yeah, so I do note that this is kind of a concern for quite a few people who are looking at taking out a scholarship, but do note that we are here to help you. We are here to help you at MOH Holdings. Okay, I'll proceed on to my last question. So this is for all three of you. So do you have any words of advice for students who A, want to apply for the scholarship, and B, who wants to come into the healthcare industry? Maybe we can start with you, Keegate, and then we go to Tiffany and Clarence can finish up.
I think I would want to advise that you apply for the scholarship. Then if it fails, and don't be disheartened and give up on your healthcare hopes. Continue, because I failed twice. I had the healthcare. I only get my scholarship upon my second interview, so I was repeat the following year. So don't dishearten just because you were rejected once. Then you just give up your hopes and passions for that. No, just try harder the next time. And then if it's not possible, there's many other routes that you can still go into healthcare. So don't see it as the end of your hopes and passions. And secondly, for people who wants to come into healthcare industry, right, be prepared to what you're gonna face for the next 10 years down the road. Of course, you spend so much time studying, graduating from a degree like this. You wouldn't want to just, have a year or two into the industry, and then after that say, oh, I cannot take it, I cannot make it, give up. So be prepared, do a lot of research to see whether is it something that you really want to do, and not just because of the money, but after 10 years of working in the same industry, will you be still be passionate about your work, or are you just gonna be happy every end of the month receiving salary? So you gotta balance it out, and then see what is it that you really want, because healthcare is definitely a big commitment. Yeah, that once you want to really want, so then do it. Yeah, that's it.
Okay, I think for me, I think like what I think Clarence said earlier, yeah, to really know what you are in for, because you're gonna study for 4 years. Yeah, and I think if you don't enjoy what you're studying, then the 4 years are gonna be quite like dreadful and very long, plus the later 4 years bond. Yeah, so I think to really go and read up, watch videos, go and ask friends who you know are in this industry to learn more about what is like what is really like out there in the working field. Yeah, and what you will be studying in school. Because I think when you enjoy, like really really enjoy my social work modules, and it comes very naturally, when you enjoy, that you will do well, that you will have fun. It's not like so I need to study again, but it's like oh yay, okay, another new topic. Yeah, and the topics are really very interesting. Yeah, so I think really go and get to know your modules, get to know what you're in for. Yeah, and I think when you apply, to also apply with the confidence that you know you're up for it, and to not doubt yourself. Yeah, I think when I went into it, I really like, okay, I can do this, and then I went to apply, because I knew that it's gonna be competitive and all, but I think to really know yourself and to really just be confident. Yeah, and not compare, and when you're in it, to not compare yourself to the people around you. Yeah, and to just like really be confident in yourself. Yeah, and I think when coming into the healthcare industry, it's really also learning to I think what earlier on the others have said, to build your communication skills and empathy, because I think it's really important. I think that's what I learned in group projects also, actually in school. You have to also have good communication skills and empathy, because you're working with different people from different backgrounds. You don't know who they are, where they are from, or what they are struggling with. And I think when we enter into this industry, that's very important, because we know that everyone has their own journeys and in their own life. And I think having that empathy and good communication skills is very important, because I think everything we say and do and interact with people, it leaves a mark in them. Like for example, that social worker who left the impact on me, and now I'm also pursuing that same route. Yeah, so I think it's really important the way we present ourselves and the way we speak to others. Yeah, so I think these are just some small advice, and yeah, the road is long ahead, but I think if it's something you're really passionate about, to really go into it well informed and prepared for what's ahead. Yeah.
I mean, just to add on also to that, my first initially when I came into this, I also tried a lot of different paths. So, practical tips on how to explore. I think in Singapore you can always reach out to the scholarship officers and all. Previously, I got chances to go and shadow like physiotherapists. I shadow a podiatrist, just to go and see what is their job like. Right, and I think if you are questioning, you don't know where you want to go, right, there are all these kind of opportunities where you can shadow and see, right, ask your seniors, ask your friends, just make an informed choice and know what you are in for. Okay, and then I think the second part of that is, once you already had that goal, you got to keep refreshing yourself, because when the times are good, it's easy to you know why you're in it, but indefinitely times will become tough. Your workload will increase. You'll do badly in a certain module, and you'll start questioning. You might start thinking, hey, why am I in this? Right. So one thing you can do for yourself, you can write down your thoughts at this point, and then next time when you hit tough times, can bring it up and remind yourself, because eventually the thing about healthcare is that the work that we do eventually has direct impact to people. And I think that's the thing that we have to remember lah. And you're not just working in machines, and you are just a dispensable piece in the clockwork, right? But you contribute to a much larger system, and you never know, one day you might be the one inspiring the next generation, like what Tiffany shared. She was inspired by a medical. I hope you get in contact with him also, let him know that, you were inspired by him, and then that would also remind him that, okay, that's the reason why I'm in this profession. So I think, yeah.
Thank you, speakers, for all your insightful sharings. We have come to the end of the session and hope you have benefited from all the sharings. So if you have enjoyed this session, please take a few seconds to read the program at the bottom left of your screen. Our next session is the second part of Dare to Care, a call to our future healthcare scholars. It will be starting at 2 p.m. There will be sessions with the healthcare clusters, National Healthcare Group, National University Health System, Sing Health, and Agency for Integrated Care. So another gentle reminder that our exhibitor booths are currently open for chats. So you have more questions, feel free to chat with any of the representatives. We look forward to seeing you in our 2 p.m. session, and go have a good lunch, and we'll see you soon. Thank you once again. Thank you.